Did you know that depression is a hidden struggle affecting 300 million people worldwide? It's tough to spot early on and can leave people feeling exhausted, restless, angry, or even hopeless. It also messes with motivation, focus, and decision-making, often leading to behaviors that make things worse. In this video, we'll uncover 10 surprising ways depression can affect someone, from isolation to self-destructive habits. Stay tuned, because number 7 is something almost no one talks about. Terrible eating habits. When someone is depressed, they may overeat or not eat at all. Depression can significantly alter your eating habits, leading to negative effects on your physical and emotional well-being. It can cause fluctuations in appetite, leading to overeating and weight gain, while emotional eating can be triggered by feelings of sadness, anxiety, or numbness. It can also trigger cravings for comfort foods, disrupting regular eating patterns, and causing a lack of motivation for meal preparation. While some of you may not be hungry and may even find food distasteful, others may find themselves in the kitchen devouring everything in an attempt to eat away the emptiness or loss they're feeling. Some of you may be so exhausted that the thought of preparing a meal seems overwhelming. It is crucial for individuals struggling with depression to seek support and develop healthy coping strategies to manage their relationship with food. Isolating yourself. People with depression tend to isolate themselves for a variety of reasons. Depression can lead to a vicious cycle of isolation. Some people find socializing overwhelming and would rather keep to themselves, while others believe that being by themselves is preferable. In other cases, the person may feel such intense self-loathing that they would prefer to stay away from social situations. Extremely sad people may stay indoors for weeks at a time. This can result in feelings of loneliness and depression, as individuals may feel a burden to others and feel unworthy of social connections. Low self-esteem can also contribute to isolation, as individuals may fear rejection or judgment. Depression can also impair communication skills, making it difficult for individuals to express themselves effectively. Acquired internalized stigma. Depression can lead to internalized stigma, which can manifest as self-blame, feelings of inferiority, fear of judgment, self-stigmatization, social withdrawal, and avoidance of treatment. These beliefs can cause individuals to view themselves as crazy, weak, or broken, leading to a diminished sense of self-worth and self-esteem. This can also cause them to withdraw from social interactions and support networks, and exacerbate feelings of loneliness and isolation. Additionally, internalized stigma can hinder recovery efforts and hinder the development of maladaptive coping mechanisms, such as self-medicating with drugs or alcohol, engaging in self-harming behaviors, or withdrawing further into isolation. Individuals with depression must challenge these negative self-perceptions, seek support from trusted allies, and advocate for themselves in overcoming stigma and accessing appropriate care and treatment. Some may deny the reality of depression, viewing it as an excuse for personal failures. This can cause individuals to feel self-conscious about their struggles. When depression symptoms appear, individuals may seek explanations that avoid the stigma, such as attribution to poor sleep, which is a common symptom of depression. Clouded thinking. Depression can cloud your thinking by distorting your perceptions, impairing your cognitive function, and perpetuating negative thought patterns. Negative thoughts can lead to a pervasive negativity bias, skewing your interpretation of events. Rumination, triggered by repetitive thoughts about past failures or perceived shortcomings, can impair our ability to focus on the present moment and problem-solving. Concentration difficulties can hinder your ability to think clearly and make decisions. Memory problems can result from memory impairment, leading to confusion and disorientation. Cognitive slowing can cause delays in thinking, speaking, or problem-solving, leading to frustration and inefficiency. Overgeneralization can reinforce feelings of hopelessness and self-doubt. Cognitive distortions, such as black and white thinking, catastrophizing, and personalization, can also contribute to clouded thinking. Being disorganized. Cleaning a room or your house is a difficult undertaking when you're depressed since you're so exhausted. Unclean dishes and garments start to pile up when your trash is filling the trash container. It becomes even more physically taxing to move throughout your space because everything is on the floor. Being exhausted exacerbates the unease that comes with living in a busy place. It can result from a lack of motivation, cognitive impairment, poor concentration, decision-making challenges, procrastination, and difficulty with planning and organization. Motivation can be lost, making initiating tasks or following through with commitments difficult. Cognitive impairment can affect memory, attention, and executive functioning, making remembering important details and maintaining focus difficult. Poor concentration can also be a challenge, as individuals may be easily distracted or mentally preoccupied with negative thoughts. Decision-making abilities can be affected, leading to indecisiveness and hesitation. Procrastination can result from feelings of overwhelm, self-doubt, or fear of failure. Physical symptoms like fatigue, lethargy, and psychomotor retardation can also impact task completion and organization. Struggling with sleep. Depression affects your sleep schedule. Some people may stay up late and sleep little. Your unwanted, compulsive thoughts keep you up at night. These can cause you to feel anxious all night long. Some of you may sleep too much and are still not well rested. Depression can lead to insomnia, hypersomnia, changes in sleep patterns, early morning awakenings, nightmares, physical symptoms, and circadian rhythm dysregulation. Addressing these issues is crucial for managing depression and improving overall well-being. Seeking support from mental health professionals and exploring strategies for improving sleep hygiene can help individuals manage their condition. Feeling guilty and feeling self-hatred. A persistent cycle of negative self-talk, rumination, exaggerated responsibility, social comparison, distorted self-image, and cognitive distortions is indicative of depression. You will most likely feel hateful of yourself if you allow depression to control your thoughts. You'll continue to talk badly to yourself, which usually leads to issues with self-worth and a poor perception of yourself. Eventually, you will feel that you are no longer worthy of respect. These negative thoughts can lead to feelings of guilt and self-hatred, as individuals feel obligated to blame themselves for negative events or circumstances beyond their control. Some people who suffer from serious mental illness may even feel guilty because they think they are to blame for all of their problems. Social comparison can exacerbate feelings of inadequacy and self-hatred, as individuals believe they fall short in comparison to others. Depression also leads to a lack of self-compassion, leading to self-punitive behaviors and harsh self-judgment. Cognitive distortions, such as all-or-nothing thinking and catastrophizing, further exacerbate these feelings. To combat depression, individuals should challenge negative self-talk, practice self-compassion, and seek support from mental health professionals. Living in fear. Depression patients are concerned about unpleasant things happening to them. In extreme cases, some of you will undermine a positive situation because you believe it will go wrong. Sometimes people pass up opportunities and stop pursuing their aspirations. It's a counterproductive self-defense method since it prevents you from living your life and accomplishing great things. Existential fear can arise when individuals question their existence and struggle to find meaning in their experiences. It can also intensify fears of failure, rejection, and abandonment, causing individuals to avoid social interactions and relationships. The fear of loss can heighten attachment to people, possessions, or routines, causing a sense of hypervigilance and reluctance to change. It is crucial for individuals struggling with depression to seek support from mental health professionals and develop coping strategies to address these debilitating feelings of fear and anxiety. Thoughts of death or suicide. Depression can cause intense emotional pain, leading to thoughts of death or suicide as a way to escape these feelings. Cognitive distortions, such as black and white thinking, catastrophizing, and overgeneralization, can amplify these feelings, making death or suicide seem like the only solution. Suicidal ideation is another common symptom, with persistent thoughts about death or suicide. This can become increasingly distressing and difficult to control over time. Depression can also impair individuals' ability to envision a future, leading to a sense of emptiness and purposelessness. Depression significantly increases the risk of suicidal thoughts and behaviors by fueling these feelings. It is crucial for individuals struggling with depression to seek help from mental health professionals and seek support from trusted friends or loved ones. Weight gain or loss. Depression can impact appetite in various ways, with some experiencing a loss of appetite, leading to weight loss, while others may experience an increase in appetite, leading to overeating and weight gain. Emotional eating is a common coping mechanism for depression, leading to the consumption of high-calorie, high-fat foods. Depression can also disrupt normal eating patterns, leading to irregular meal times, skipped meals, or binge eating episodes. Some medications prescribed to treat depression can cause weight gain as a side effect, altering metabolism and increasing appetite. Physical symptoms like fatigue, lethargy, and sleep changes can impact energy expenditure and physical activity levels. Stress hormones like cortisol can influence appetite, metabolism, and fat storage, contributing to weight gain. Depression can impact weight through various factors, making it crucial for individuals to seek support and develop healthy coping strategies. Remember, if you or someone you know is struggling with depression, you are not alone. Help is available, and there is hope for brighter days ahead. Reach out to a trusted friend, family member, or mental health professional for support. Together, we can break the silence, shatter the stigma, and build a community of understanding and compassion. Take care, and remember to prioritize your mental health. Thank you for watching, and don't forget to subscribe for more content on mental health and well-being.